Apollo Hospital was the only private hospital which was allowed to admit and treat COVID patients by the government. At that time, my wife asked the ID specialist who was taking care of me, so what next? So he tells her, just pray.
Family.
Love.
Holiday.
Fun. And no work.
Okay. Hello everyone, welcome to our podcast. Today we are joined by a very special guest, Dr. Ravi Andrews, who's a nephrologist practicing at Apollo Jubliee Hills in Hyderabad. So hi doctor, thank you so much for joining us today. A little background about yourself if you can, for the viewers who are not aware about you.
Thank you very much, Fuju, for having me on the show.
Thank you.
And so I am a nephrologist. That's basically kidney specialist for the uninitiated. And I have been working at Apollo Hospital for the last 20 years, from 2001 onwards. And I practice nephrology. And I think as this podcast goes on, we'll have more information about what exactly I do, how I do it, when I do it, and where I do it.
Definitely. So let's start with understanding the young Ravi Andrews, maybe 20-25 years back in time. What exactly enticed you to move towards the medical field?
Well, we'll talk first about the young Ravi Andrews. That's very, very, very long ago. I was born and brought up in Mumbai.
Yeah.
Typical Mumbai public school product. And we used to stay in a place called Kulaba. At that point of time, till the age of 15, I don't think I did anything significant in my life. The only significant thing I did was probably pick up the guitar at the age of 15. And at that age, people pick up guitar for one and only one reason: to score chicks. At that point in time, the only thing that could help you score a chick would be either you have a motorbike or a guitar. So it was much easier to get the guitar. So I started that off. Then medicine happened. Now, after medicine happened, I had to give up guitaring, at least for some point in time. And there was a point in time where I wanted to professionally go into music, but then medicine happened and that didn't happen. Now, why did medicine happen?
Yes.
I can be very politically correct here and say, at a young age, I wanted to help people, I wanted to do good, I wanted to change the world. At that young age, yes, you do want to do things, but you don't want to do it through a medicine perspective.
Yeah.
You either want to be a revolutionary, or you want to go into sports, or you want to do something special or be a writer, or make a film or something, and then do something special to change the world then. But I'm not going to say that I wanted to do medicine to change the world, because I was a good person at heart and I wanted to do good things. The reason I did medicine was because I didn't want to do engineering.
Okay.
And the reason I didn't want to do engineering, we'll just go back into time. See, we're talking about the 80s.
Yes.
At that time, you were not even born. Probably your parents also hadn't met each other. So at that time, after 10th, you had only three choices. You do either arts, commerce, or medicine, or science.
Okay.
If you do science, you have only two choices: engineering or medicine. That's it. No other choices. Mm-hmm. My father happened to be an engineer.
Okay.
And
you didn't want that.
Initially, I was not very good at math and physics, so he would teach me. Later on, I got good at math and physics. I got so much good at it that I was better at it than chemistry and biology. But my father, God bless his soul, he's not here with us, but he was a very bad teacher. And I knew that if I got into engineering, he's going to teach me the engineering subjects and he's going to make my life hell. So the only reason I got into medicine was because I didn't want to do engineering. And that's what happened. I got into medicine.
But were you so averse that you were able to crack the medical exam just to stay away from his teaching?
Well, I guess I was reasonably good at studies.
Okay.
And maths and physics were they were my strong subjects. But chemistry and biology wasn't too hard either. So luckily I managed, luck and a little bit of effort as well, I managed to crack the exams and got in.
And then you did your medicine from where?
I studied in CMC Vellore. I think some people would know about it. It's a pretty good institute. Finished off the MBBS there.
Mm-hmm.
Unfortunately, by the time I finished MBBS, all of us realized that MBBS was not enough and you had to do something post-graduation, either medicine or surgery or obstetric gynecology or pediatrics. So then I went on and did internal medicine. I did that in Mumbai in Hinduja Hospital.
Okay.
By the time I finished internal medicine and became a physician, we all realized that that's not enough. You need to do a sub-specialization. Yes. So either in cardiology, nephrology, pulmonology, neurology, something. And ironically, most people who get into medicine to escape physics and maths.
Yes.
And I got into nephrology, which has got a lot of physics and maths in it.
Physics and maths?
Yes, it's a lot of calculations, and it's always 2 + 2 = 4 in nephrology. It is as mathematical a branch of medicine as you can get.
I didn't know kidney involves numbers.
In fact, I'll be a little technical here.
Yes, please.
So things like the creatinine, the sodium, the potassium, these are all numbers. There are numbers attached to it, and we can look at those numbers as nephrologists. We can make interventions. So say, for example, the sodium is high. You can give some treatment to reduce the sodium. You can calculate how much treatment you want to give. You have to calculate the treatment you want to give. And you make those calculations, and you can predict that tomorrow the value is going to be this if I do this kind of calculation and give this kind of treatment.
Yeah.
And that applies to almost all the chemicals in the body. The main ones like sodium, potassium, which are the common electrolytes.
Yeah.
You can make the calculations and you can predict what it's going to be tomorrow. And that's what makes it so mathematical. Even something like dialysis, simple process.
Yeah.
That also you can predict at this time, if I start dialysis and I do so many hours of dialysis, I can approximately get the creatinine or the urea, which are the toxins, to this particular level. And sure enough, lo and behold, the next day when you come and do the testing and check, it's likely to be closer to the level that you expected it to be.
But
So
that's like an advantage, right? You know what is happening even when you're not physically present then.
Yes. So I'm a nephrologist, right? So I'm going to be veering towards nephrology. I'll have a bias towards it. It's, like I said, the most mathematical branch in medicine, that's for sure. Second, it encompasses all kinds of treatment. Like, for example, if you have a kidney problem, you can diagnose it by doing a basic test called a creatinine.
Yes.
This simple. You do a creatinine, it's elevated, you know you have kidney problem.
Yes.
For if you look at another branch of medicine, say somebody's got chest pain. Chest pain could be anything from the bone, from the muscle, from the heart, from the GI tract, so some acidity. It could be something from the nerves. So you're not sure what it is.
Too many switches to tap onto.
Exactly. You put that really nicely.
Yes.
So, whereas for a kidney thing, you do a creatinine, you're clear. This is a kidney problem. Then next step, why is the kidney problem? You do a kidney biopsy, you get the answer.
Okay.
Luckily, you have two kidneys. So even if you poke one and something happens to it, the other one is there to take care of it.
Yes.
All the other organs, most of the other organs in the body are not paired organs. So you're a little scared to poke them and get a biopsy to get a tissue diagnosis. So you get a diagnosis with the biopsy. Once you get the diagnosis, you have a treatment. You either do dialysis, which can keep a person going for quite some years, or you do a kidney transplant and they're done and dusted. They're game over, game done.
Basically, two-step process for you, but a lot of math.
Yes, a lot of math, yeah.
So, like you said, after your, your stint at Bombay Hospital, Hinduja, after that, why did you choose nephrology and not something else?
During your medicine posting, you rotate through all the subspecialties. So you spend 3-4 months in rheumatology, 3-4 months in neurology, cardiology, and at the end of it all, you put it all together and you decide which one you're going to do a subspecialization in.
Okay.
So for me, every posting that I went through, and this is a tribute to the teachers that I had. Every posting that I went through, so I went through cardiology, I wanted to do cardiology at the end of it. I went through neurology, I wanted to do neurology at the end of it. I went to gastro, I wanted to do gastro at the end of it. My last posting happened to be nephrology.
Okay.
And I really enjoyed it. And my boss, his name is Dr. Bharat Shah, he's still practicing in Mumbai. So initially I was a little skeptical. I said, nephrology, it's also mathematical. There's nothing clinical here. Then he said, work with me, Ravi, work with me for 4 months, 3 months. At the end of 3 months, I was sold. That was it. I decided I was going to do nephrology because one, it's so mathematical, so clinical, and you can from A to Z, diagnosis, confirmation of diagnosis, treatment, transplant. It's there all along it's there. Yeah. It's not there in many other branches. Like for cardiac disease, cardiac
There's
transplant
multiple
is
ways to go about everything.
Yes, and the final result or final answer would be a transplant. It's so rare. It's so difficult to do. Same with lung transplant. Kidney transplants are so easy and so simple. In fact, one of the great nephrologists in our country once said, kidney transplant is so easy you can do it under a tree if you want to.
So how many transplants have you successfully done so far?
So
You keep a track?
I haven't been keeping a track, but I can say on an average, I do probably 2 a month.
Okay.
So we're talking about 15 years. So you can do the math. I'm a nephrologist. I don't do math.
Okay. So you put down the guitar when you were going to go to college, and then when did you pick it up again?
So medical college gives you a little bit of an opportunity to explore other talents, because it's not just about those. At least the place where I trained, those 5.5 years, it's not like you're totally under a bushel and you're just sitting and mugging and not doing anything else. They give you a lot of opportunity to explore other things, to try out your talent. So,
But do they give you enough time for it?
you have to create the time. Everybody has the same 24 hours. What you do with those 24 hours is your business.
True.
So we somehow did manage, and there were like-minded people, so we could all get together and somehow manage to find time. So I explored music, I explored a little bit of acting, those kind of things, but that also helped you to switch off. Otherwise, just sitting and mugging, keeping your mind there, tunnel vision doesn't really help. So I got an opportunity to explore musical talents there. We have these house competitions, inter-class competitions, all these things, so we would take part in them.
So did you hit the ground running, or was it like building yourself back up again with the guitar?
No, I didn't hit the ground running. I hit the ground crawling, because there's this Brian Adams song, played the guitar till my summer of 69. Played the guitar till my fingers bled.
Yeah.
And that's exactly what happened. Over there, I went there, and then we had to do blood testing for ourselves.
Yeah.
In the first year, physiology.
Yes.
So we had to
On the
poke
glass
ourselves with lancets and check our hemoglobin.
Yeah.
And we had to do it ourselves. So I would do that in the afternoon, and then I would go back and play guitar in the evening, and then my fingers would be bleeding, and I would remember Brian Adams. Yeah, you're right. So it was a little tough to find time. I obviously didn't hit the ground running, but we got together, a group of us. We managed to.
Oh, so you guys had a band?
We didn't have a band per se, but then when the class got together, that would be the class band. It was not one particular hospital or college band.
Okay. So when did fitness come into your life?
When I joined medicine, I was a 37 kilo weakling. I was 37 kilos when I joined medicine.
I need to see pictures of this.
You wouldn't be able to see me. I was invisible almost. So, but I was always into sport.
Okay.
And in CMC Vellore, we have got a huge campus. So there's a tennis court, there's a badminton court, basketball, volleyball, cricket ground, everything. So, and we had table tennis tables, everything. We had all the opportunities to play. So I used to play a lot of sport.
Okay.
And then of course we also had a gym attached. It was we're talking about 1980s, mid 80s.
Those colored dumbbells, metal ones.
Not even colored. They were just metal, iron, rusted. And there would be these Roman rings.
Yeah.
It had always been my thing to do a crucifix, my dream. I couldn't do it, but anyway, the rings were there, and then there were these parallel bars, the steel parallel bars, a few little weights, and also that gym was just attached to the hostel.
Okay.
So 37 kilo weakling. So everybody would kick me around. So I said I need to build up some muscle. So I joined the gym in addition to the
Playing
games
sports
that I was playing. I was 58 kilos by the time I left.
So was there anyone to guide you?
No, it was all the seniors who would guide us.
Monkey see, monkey do.
Absolutely. So after that, I stopped gym after I left medical college. Then I got into sport. I overdid the sport, damaged my ligaments, my knees and my back and all that. So then I had to finally give up sport. That's when I came back to gym. So that was in 2000.
So you stepped into gym because you couldn't play sport, or you stepped into gym to rehab yourself?
No, I stepped into gym because I couldn't play sport. I wasn't that bad that I needed rehab. So, but I needed to keep myself fit, and I couldn't do it because I couldn't play. So the only other option was back to gym.
And that was in which year?
2000.
2000.
Yeah.
And then you
21 years ago. You would have been how old then? You would have been 5 or 6. You would have been in your almost in your nappies. Yeah.
I was pretty much averse to gyms and stuff back then when I was a kid. So how much of your medical knowledge were you able to use into fitness early on?
That makes a big difference, and I'm glad you brought that up, because generally otherwise people who go to the gym, they're completely nouveau. They really don't know anything, what to do, how much to do, and they're often guided by trainers who've been trained, maybe who have themselves have been trained only for 6 months or so, or maybe sometimes even 6 weeks. What advantage we have as medicos is we understand anatomy. So you know which muscle acts at which place and how you can isolate that particular muscle, because workout is about isolating a particular muscle and a joint. You don't want to use multiple muscles to move a particular joint. So then if you know some basic anatomy, you can understand
basically there's better micromanagement.
Yes, and your movements and your muscle action that you use, you can minimize it to have maximum effect with minimal impact.
So, but also at the same time, being a medico, I think you must have had better knowledge when it came to how to fuel the body in order to get the optimum results, along with the anatomy knowledge, right? So how much of it were you able to derive from your medical college and then apply it in the gym?
Now, as far as fueling is concerned, I think we need to make it simple. I'm not a big advocate of using those protein shakes and all. In fact, come to the gym and half the time, half the boys are doing this. So, I'm not really, in fact, I'm going to strongly recommend against it in our talk later on. So using protein shakes, using food supplements, protein supplements to refuel your body is not good. It's not the right thing to do. Unless you want to become like Arnold Schwarzenegger or, one of those Mr. Universe, Mr. India types. In that situation, you have to be ready to give up on your health, your overall health. Health is not about looking good and being fit.
People get confused between health and aesthetics.
Yes. So that's not what you should be looking for. So if you are at that level, then you are going to definitely damage your body in some way or the other. So for normal people like us, just need to ensure that you eat enough protein, eat enough carbs. A lot of people cut down on carbs, saying that, I want to build up muscle, so I'm going to go on high protein, keto diet, zero carb diet. No, that's not good. Carb is your fuel actually.
Exactly.
It's not really protein. So you must take enough carbs, enough protein. Keep it simple. If you're a vegetarian, eat as much veg protein as you possibly can. If you're non-vegetarian, eat as much as your stomach allows you to eat. It's not like, you should eat 2-3 tandoori chickens and, just build up your protein levels that way. So keep it simple. Eat a normal, maybe slightly higher protein diet than normal people. Ensure you take enough carbs. And most importantly, ensure that you take enough liquids, because that's a major mistake people do.
Exactly. I was going to come to that. So there's this water cycle that happens in our body, right?
Yes.
So can you enlighten our viewers about that?
Yeah. So again, simplify it. You drink a certain amount of water that is metabolized and the kidney will remove it. Now drinking, a lot of people have this misconception that if you drink a lot of water, the kidneys will remove it and more toxins will come out. That's not true, because there's a fixed amount of toxin in your body and the kidney can remove only so much toxin. Drinking more water and making your kidneys work overtime in an attempt to remove extra toxins is not going to work. It's counterproductive. So what happens if you drink too much water? One, all the electrolytes in your body get diluted, and the most worrying and the dangerous electrolyte is sodium. If the sodium gets diluted, your sodium levels drop, you can even die. Starts off with weakness, giddiness, tiredness, you have those warning signs, then you start getting confused, then you go into coma, and then you can die. Recently, there's been an article about Bruce Lee, that famous Kung Fu guy.
Yeah.
And he died at the age of 33, I think, and nobody really...
I think 37.
Yeah. You
not very sure, but somewhere in the
30s.
Yeah.
So, there were a lot of theories, conspiracy theories about how he died. He was poisoned, he was this, he was that. But some medical people got together, a nephrologist amongst them, and they felt, looking at all this symptomatology, that he probably had very low sodium levels. In his part of his Jeet Kune Do, that's the thing, the Kung Fu thing he started. So in that, he advocates drinking a lot of water. So he used to drink a lot of water, and obviously his sodium levels would have dropped, and that's what probably caused the brain swelling. He died of cerebral edema, and that causes death. So drinking too much water, definitely not. And drinking too less, also not. So the next question is going to be, how much should people drink? It's 2 to 3 liters per day, and your body will tell you how much you need.
Yes.
But generally 2 to 3 liters per day.
But for a very active individual,
you can add a liter to that.
You
can add a liter, but not
half, right?
10, 5, 8 liters, which people do.
Yes.
That's not at all good for you. It's overloading your kidneys and it's diluting all the
But apart from water,
sodium.
what other things would you recommend for people to use for hydration in cases where there's a sodium crash?
Yes.
Or there's a potassium crash. Now, how to manage that at home?
these things, Fuju, you can't really manage at home unless you have some blood test to tell you what it is.
Yes.
You cannot make a clinical diagnosis of low sodium
But I
or
feel
low potassium.
the sodium crash, the first flash warning is probably cramps and dehydration, right?
Yes.
So how do you make people manage that?
Yes. It's simple, no? I mean, if you're cramping or dehydrating, drink more water. And
But then I know personally so many more people who are averse to drinking water.
No, see, we can recommend. What you do is your business. But the recommendation is if you're cramping and you feel your body is rehydrated, drink more fluids and preferably drink fluid with a little bit of salt in it. But again, don't overdo that.
Yeah.
Don't take stuff like Electrol and ORS and all those kind of things. Gatorade maybe. I'm not officially promoting Gatorade, but yeah, that's probably the
Basic
best
idea
combination.
is to take a good amount of electrolytes.
Yes.
Basically.
And your body will tell you, like you said, if you're cramping, it will tell you that there's something going on and you need to stop. I think the more important thing is to stop exercise then, rather than trying to replenish and then getting back to exercise. Stop right there. If your body will tell you if you're nauseated or you're having some chest pain or you're feeling giddy.
Sometimes
or you're
it's
cramping.
also a headache, right?
You can have a headache as well. So anything new which is happening while you're working out, stop workout immediately, and then sort out the rest of the thing.
Yes. So, what do you feel about kids these days abusing creatine? Now we are getting three to four different types of creatine in the market. There's monohydrate, there's nitrate. So, I personally feel it is a decent enough supplement as long as everything has a place. Doesn't mean you abuse it. But for the kids who are like going crazy about it and are planning to take, because in the fitness industry, creatine is one of the most researched upon supplement.
Yes.
So, what advice would you give the young kids who are acting obsessed about it, or are thinking of taking it, thinking that it will magically transform their body? So maybe you can start with explaining how creatine works in our body. What chain does it take to break down in the body, and what kind of result one can expect?
Oh my God, we're getting technical here. I'll simplify it. But you gave the answer in the beginning itself.
I mean, I want you to break it down for the people in a better manner.
So no, you gave the answer in the beginning itself by saying that you need to get yourself tested before you start these things. But we'll come back to that. What really creatine does, it's an end product of muscle breakdown.
Yes.
So it's there in the muscle. When you work out, it breaks down creatinine, and this has to come out somewhere. It comes out through the kidney. So as your muscle is breaking down, obviously, and it's losing creatinine, obviously you want to replace it by giving creatine. Creatine is a precursor of creatinine. So it starts with creatine, broken down to creatinine, which is excreted to the kidney. So you definitely want to build up the creatine because it's breaking down. You can take a supplement. Now what? You've taken the supplement. Where is it going to go? It has to come out through the kidney. If you have even a minor kidney dysfunction, where it's not able to excrete the amount of creatine that you're taking in, the creatine levels in your body are going to go up, in your blood are going to go up. If the creatine level goes up in your blood, you are going to have weakness, giddiness, vomiting, all the symptoms of kidney failure. Because the same thing happens in kidney failure. In kidney failure, the creatine level goes up. So the creatine level goes up either due to excessive intake of creatinine, excessive breakdown by the muscle, or reduced excretion by the kidney. Any of these three measures or all three together could contribute to raising the creatine.
So basically, that cycle has to keep moving. Any one part of it does not work, the whole cycle breaks down.
The cycle breaks down, the creatine level goes up, and creatine is dangerous because it's a toxin.
Yes.
It damages the bones, it can damage your bone marrow, reduce your hemoglobin, can cause confusion, cause heart problems, liver problems, can cause your blood pressure to go up. So there are a whole lot of problems which happen with elevated creatinine. So before you start creatine, I have no objection.
Or in general, just let them know before you use any supplement, it's important to get yourself tested.
Simple little test, creatinine. We alluded to this in the beginning itself. Simple tests will tell you how your kidney is working. Creatinine. There are some other basic tests that we also. But
on the whole, if you just get a KFT done, the entire pictures in front of you.
And if that's normal, and the other thing is your blood pressure, because many a time blood pressure is undetected.
Yes.
So you check if your BP is high also, you cannot take these supplements because again the kidney, because the seat of blood pressure is the kidney.
Yeah.
The kidney is the cause of high blood pressure.
Yeah.
The heart is the victim of high blood pressure.
Yes.
And this is one concept I want to straighten right away, because everybody believes...
People confuse it the
yes,
other
they
way.
believe heart is responsible for high BP. No. Research has shown categorically that the kidney is responsible for high BP, and the heart is a victim. So if your kidney, if you have high BP, you already have a subclinical, what we call subclinical kidney dysfunction, which is not overt.
Yeah.
So a kidney dysfunction a high creatinine does not necessarily mean that, or rather a kidney dysfunction does not necessarily mean that you should have a high creatinine.
Yeah.
You can have a kidney dysfunction with a normal creatinine, but there are the warning signs. The warning signs is some problem in the urine or high blood pressure. So BP check, creatinine, and routine urine before you start creatine. If all these are okay, please go ahead and take creatinine, but again, limit it.
Yes. You should know why you're using it basically in the first place. You can't just look at others using and be like, I want to look like them, so I'm just going to copy what they're using.
You can't just jump onto the bandwagon and just follow the leader.
Yeah.
No,
blindly,
you got to be the leader.
Not even knowing what creatinine is. Now, another product that is doing well in the market and also has a place for itself as long as it's not abused is L-carnitine.
Yes.
Right? So, what is your take on that? And let the viewers know how it actually works in your body and what's the use.
If it's a toss-up, if you're telling me head-to-head between creatinine and L-carnitine, I would rather go with L-carnitine because it's more of an antioxidant, and it is also
better for kidney health, in fact, rather than putting it at risk.
In fact, some patients with kidney dysfunction, we give them L-carnitine. Those who are on dialysis get supplements of
L-carnitine. Carnisure.
Yes, Carnisure. Yes, Carnitor, Carnisure. So between the two, definitely I wouldn't mind using L-carnitine.
Yes.
Even just off the cuff, without even doing any kidney function or any other testing, because it's a simple thing which is produced anyway in the muscle, and then no harm. A lot of people take a lot of these multivitamin supplements have got carnitine in it, so no harm with it at all. But creatinine, again, I'm emphasizing this point. Please check your creatinine, your urine, and your blood pressure before starting it.
Yes. Just to make them understand, like how you explain how creatine functions and cycles in the body, can you just explain them how L-carnitine functions in the body?
L-carnitine is basically a muscle enzyme. Not really a muscle enzyme. It's more, it's a kind of a muscle enzyme. Yeah. It's used to improve the muscle contractility. It functions as that. But there are a lot of other things which also help in muscle contractility. For some reason, L-carnitine, because
someone has to be the hero, right?
Yeah, and it's not a double hero; it's like a single hero. So L-carnitine has been from ages past. It's been used. It's used also in cardiac muscle, because the heart also is a muscle, remember. Yeah. So skeletal muscle, which is the usual muscle that we have here, plus the cardiac muscle. And L-carnitine got its popularity because of its effectivity in cardiac muscle rehabilitation.
Yes.
So, and that got extrapolated to skeletal muscle. So that's
also
how it works.
Turn led to a higher metabolic rate of sorts, you can say, marginally, but so which is why it has probably gotten the fame that it is getting right now.
Yeah, because anything that increases muscle contractility will increase your metabolic rate. Yeah. So that's how it works. See, but at the end of the day, there's no shortcut. You have to exercise.
Things that take time are going to take time. You can't grow 6 feet tall at the age of 5. Everything's going to take time. So
even at the age of 55, you might not grow 6 feet tall.
Patience is probably the biggest supplement they should be marketing and selling right now.
Yes. Patience. Yeah, absolutely. Yeah. Patience for the patients.
Yeah. So tell us more about the journey that you had post. You finished nephrology and straight away joined Apollo?
Yes. In fact, I trained in Apollo itself for the first 3 years. And then I just got absorbed into the system.
So the last 20 years, you've been living more at Apollo Hospital than at your own personal home,
yes,
right?
Yes. Apollo is my first home, not my second.
So what has been the journey like that with working with them and how you worked up the ladder?
So, in a corporate hospital, there's no real ladder.
Okay.
It all depends on your qualification. You don't, at least in the medical part, the support services, yes, you can work yourself up, work your way up the ladder. But otherwise, it's very clear cut. Depends on your degree. If you are MBBS, you're a resident. If you're MD, you're a consultant or a junior consultant. And if you're post MD, you become a super specialist. But you have to have at least 3 years of experience. Work experience post your getting your degree. So that's what happened. I got the degree, then 3 years of experience, and then I got absorbed in the system. So it's not like I had to climb any ladder or anything. You just had to walk the path, and you're there where you reach. And in a corporate world, in a private world, not only in medicine, ultimately it's your performance that counts.
Yeah.
You help
Performance and
support.
also some time, because you yourself will need some time to show your performance, right? You can't
Yes.
show a difference in 6 months.
Exactly. So it's all about time. You give it enough time. Like you said, patience is what
Yeah.
should be marketed. You got to be patient, and you got to do justice to your work and be available. I think that's one thing which helped me get where I am is availability.
Yeah. Being at the right place at the right time.
Not
basically.
that right place, right time. It's being at any place at any time for a patient.
Yes.
That's what
Yes,
it is.
yes,
See, because that's what a patient wants. A patient wants a doctor who's available for him at any
True.
time. So if you can put yourself in that position and
Yeah.
give that to the patient, that's
So like
they'll follow you.
the pocket, like you want the car keys, you reach for it. You want the phone, you reach for it.
Yes.
So you are basically a pocket in the
So-
pant.
Okay, that's a nice way to describe me. Yeah, Dr. Ravi Andrews, nephrologist, pocket in the pant. Yeah, okay.
So I want to understand how much has the demograph or the working structure or the medical industry by itself, how much has it changed pre and post COVID?
Nowadays, in the olden days, it used to be BC AD.
Yeah.
I think now it's going to be like you said it, pre-COVID, post-COVID. The whole
Yeah.
that whole structure has changed now. Demographically, I don't think there's been much change, because whatever we were doing pre-COVID, we're doing the same thing post-COVID, probably with a little bit of more care and circumspection. But otherwise, as far as the medical hierarchy and the structure is concerned, I don't think Fujo has changed.
What I'm trying to also understand is the way you deal with patients, not just medically treating them, but them coming to you with new concerns. Given what the world in general has faced, their mindset and understanding and approach towards things has completely changed. So the way they bring their concerns to you and the kind of concerns also they bring to you has changed. So how do you tackle that? Because me being in the fitness industry, I personally face a lot of people come to me with a lot of fears, and dealing with that can get tricky at times.
Yeah. See, medicine from time immemorial is associated with fear.
Yeah.
Everybody who comes to a medical practitioner comes with fear in their mind. With COVID, I don't think maybe there's an added fear now about COVID, but
Yes.
I don't think that has changed much. They're still scared. But yes, now they're a little more careful about coming to a hospital because they're worried that they might contract the infection. One thing COVID has done, which I should have said earlier, one thing COVID has done is it has given a major boost to online consultation or telemedicine. Once upon a time, you had to go to the doctor and see him face to face and then, let him see you and diagnose. But nowadays, the facility of online consultation is there and it's taken off in a big, big way. And it would interest you to know that telemedicine was first started in Apollo Hospital itself in 2001.
But
2001, yes, it was.
back then, I don't think we had video calling, right?
No, we could do video.
2001?
Yeah, you could do video. I mean, you could have a camera and then you could upload those images, or you could do it real time
Okay.
through TV. It could be done. So they started it then itself, and they were just there at the right time when COVID
Yeah.
started. When things got a big boost, and the Indian Medical Association permitted telemedicine as a valid method of treatment.
Yeah.
So they were already on the they were the bandwagon actually.
Yeah.
They didn't even have to jump on it. So they were there.
That's
on
like
it.
almost what, 20 years
20
of patience.
years, yes. So, but of course, that time it didn't take off that well because nobody really required it. Most of the
Yeah.
time, if you needed, you would come to the hospital. So that's one thing that COVID did. Telemedicine definitely got a big boost, and now you can sit in the comfort of your house. You can get a consultation, and you don't need to wait for 2 hours for the
Yes.
doctor to see you. The doctor will see you within that 15-minute period,
Yes.
and you will get whatever treatment. You will get your prescription online. Medicines will be delivered to you online. Investigations will be done at home if you want. So this has happened post-COVID, which is not there. The other thing that COVID has done is it's allowed outpatient treatment. Sometimes we need to give antibiotics to patients or other injections.
Yes.
Earlier days, we had to admit them in the hospital
Yeah.
for that. Now this can be done at home because we have home care services.
Yeah.
So nurses will come home and they will take care of you over there with those. And COVID has done all that.
That kind of, for doctors like you, that has filtered work now.
Yes.
You can
It is
actually,
reduced.
yeah. Energy is going, your time is going into the right,
in the
right
proper way, in the
direction. Yeah.
right direction. So, and yeah, but patients now, you in this COVID times, you would have these special air filters in the rooms. You would
Yes.
have one glass thing
Yeah.
in front of the doctor, between the patient and the doctor. So that started at COVID time, but I think everybody's done away with it now. Masks have come in a big way. I mean, before COVID, nobody ever wore masks. Now every other person is wearing masks. Even post COVID, when it's not mandatory to wear a mask, still people are still continuing it. And for example, if I have a viral or a cough or cold, I would wear a mask and go to see a patient, which I would do even pre-COVID. And but now more people are following it. Even patients and patients' attendants are following it.
Basically, self-policing is happening.
Yeah, and people are taking more care about their overall health as well, because you hear so many things about post-COVID syndromes, which is true. But now here I want to stir the hornet's nest a little bit. It's become a waste paper basket diagnosis, in my opinion. So everything which is unexplained now is attributed to COVID. You had COVID in 2021, so you have this now. You had COVID in 2020, so you have this particular problem now. So it's simplifying things a little bit. But yes, COVID has its impact in different ways, and it has had medically, non-medically, economically, everything. That impact is there.
So speaking of that, a little light on your personal COVID story, because from what I know, it was very bad, and I want to know how the pre-COVID Ravi Andrews was and the post-COVID Ravi Andrews is.
Yeah, unfortunately, I don't have my pictures about pre-COVID and post-COVID, but yes, I had a bad time during COVID. Now we're talking about COVID came into the world in December 2019, and India, I think early 2020, Feb or March. And at that point of time, we were still seeing patients, and Apollo Hospital was the only private hospital which was allowed to admit and treat COVID patients by the government. Otherwise, all the COVID patients had to, by force, go to Gandhi Hospital or one of the other government hospitals. And Gandhi was the one which was identified as treating COVID. But there were corporate patients, private patients who wanted to go to private hospital. So Apollo was the only hospital which was allowed to treat COVID patients. So we continued to work through the COVID time. We were going there and seeing patients. Many a time patients come with COVID, but you don't know because you've not tested it. The testing turnaround was 24 hours. So the patient comes today, you do the test, and the next day you know that they have COVID. In the meantime, you've already seen them and you've been exposed to them. So this happened to me. I was exposed to quite a lot of COVID patients without even realizing it. We took all the precautions, the mask and all the drama dressing and everything, all the war dress, everything we wore, but still a virus is a virus. It's going to come in somehow or the other. So I got it. This was in end of June.
June
2020. And at that time, nobody knew anything about COVID. Nobody knew how to treat it.
It was just like brace yourself for the impact and let the tide go.
Yeah, just hope that you are one of the few who survive it. So, and there was no specific treatment. So I got sick. I tried to manage at home for a week. I stayed at home, suffering, fever, cough, cold, isolating myself from the rest of the family. But after 1 week, I started getting breathless. I started getting chest pain and breathlessness. So I knew that I couldn't stay away.
The breathlessness was when you were rested or when you were moving around?
Even at rest, I would feel breathless. I was checking my saturations. It started dropping after 1 week of the illness. And even at rest, I could not sleep. I couldn't lie down. I would be breathless. I would be coughing. So I said, no, enough was enough. I need to get to the hospital. So set off. And, because this was uncharted territory then, I didn't know that I was going to make it, because there were so many horror stories of people dying of COVID. So I went to all the rooms in my house, just had a look at it and said, am I ever going to come back here again? It was, I was in that mode. Then while I was being taken to the hospital, I just looked back and, my whole family standing at the window looking out. I mean, it was a surreal moment. It was like crazy. So reached the hospital over there. My saturation level was some 70 or 80. At home, it was showing 92, 93. So, these pulse oximeters which they market, they're not really that good or accurate. So it was 70, 80 by the time I reached the hospital. Immediately put on oxygen, high flow oxygen. And at that time, my wife asked the ID specialist who was taking care of me, so what next? So he tells her, just pray. That was it. So she didn't tell me what he told her, but then, it just impacted her really badly. And I knew I was really sick because I'm usually so fit. I never ever have any problem, breathing difficulty, just lying down and not able to take a breath. Going to the bathroom was a big job because I would get breathless. And I thought I was not going to make it. That whole night I'm lying on my back and the lights, I'm not able to sleep, lights in front of my eyes. when you're driving somewhere, when sometime after a party and all, you're a little lost and you lie down in the back of the car, somebody else is driving, and you see the street lights going past you, and you're all dizzy and you just don't know where you are, what's happening. That's the feeling I was having.
Okay.
And I had near-death experience. I've been, from a medical perspective, I've been very curious about these near-death experiences. There are situations where a patient nearly dies, and we pull him out of it. And then I've always asked them, "What did you feel? What did you see? What happened when you were almost, when they get better, when you're almost near death?" And they universally say that they are going towards a light. They're in a tunnel, and they're going towards a light, and they're trying to reach out for it. They're trying to reach that light. And then suddenly they're pulled back. They're pulled back and they open their eyes and they're here.
Okay.
I've asked at least 3 or 4 patients there, and they've said that. I didn't have that kind of a near-death experience, but what happened was I'm lying down on my stomach because you're supposed to prone for better breathing, and I couldn't breathe properly. And suddenly one bull-like creature gets off my back and this canters off. And you know what kind of bull? That bull you have in these
villages.
Not the villages, in these parks and all, amusement parks, no?
Yeah.
That rodeo bull, you're supposed to get onto it and stay on it for some time.
Yeah.
So that kind of bull suddenly gets off my chest and bum, and canters off, and then suddenly I can breathe properly.
Okay.
That's my COVID bull. I got rid of the COVID bull. I mean, it was a weird experience, and always I've been on the other side of the table.
Yes.
This time I was on this side of the table, and I could really experience what a patient felt like.
Yeah.
So anyway, so the bull got off me.
And you were at the hospital for how many days?
I was in the hospital for a week. And the worst part was the second day, after I was just getting better, and then my wife gets admitted because she also got COVID.
Oh no.
At that time, the only person who was at home was my daughter. She was writing a 10th standard exam. It was right there, 10th standard exam.
Okay.
So the first question I asked her is, what about Nakshatra? What's she going to do at home? She's all alone and you're here. Both of us were in the hospital for a week.
Who was taking care of her then?
She managed on
By
her
herself?
own. Yeah. We had a maid who, we gave her an option. Either you go home
or you stay
or you stay for next 1 week till we come back. And she's very nice of her. So she stayed back and she took care of her. But yeah, so that was the more crazy and scary experience. Was our daughter all alone at home and we COVID lying down here. So that was
maybe
scary.
That was one thing that kept you going, saying that you need to go back home for her.
Right from the beginning, that thing was there, that positive attitude was there, like I have to get back. I can't let this little virus beat me.
Yeah.
That was there. I mean, I never ever gave up, but there were certain times when you felt like, this is not in my control. What am I going to do? So that COVID experience, it changed me. It made me a little more understanding of other people's suffering, though as a medico, you're supposed to empathize and understand that and feel for them.
Yes.
But somewhere along the way, it slowly gets diluted because you see so many people suffering after some time.
Exactly.
It looks very similar. So yes, I learned more empathy. I learned the value of little things in life.
Yes.
Otherwise, you take things for granted. I learned the value of family and close friends, because I know this sounds unscientific, but I think the only reason I survived was because of the good wishes of all the people that I had treated and who I had taken care of and who wanted me to get well. I think that's the reason, sole reason. It's not medicine, it's not luck, it's nothing. It's just good wishes. And I think that's what our focus should be. Be the best possible person that you can be, the best possible version of yourself that you can be.
Yeah.
And everything will fall into place.
So how much about your perspective when you send off patients now home after treating them from a very bad phase?
Yes.
Compared to before you got COVID and now, how much that has changed? The kind of emotion and feeling that you let go of that patient to go back home, how much has that changed?
Now I'll answer this question in a different way.
Yeah.
I've always been asked, what is the most satisfying moment as a doctor? And 99% doctors will tell you, a really critically ill patient was admitted, he was sick, he was dying, we did whatever we could do, we treated him, we saved him, and he walked out of the hospital thanking us.
Yes.
That is real job satisfaction. 99% doctors will tell you this. I'm going to differ a little bit there. And I learned this after 15 years of practice of medicine. I did not learn this in the beginning. In the beginning, for the first 5 to 10 years, I was thinking, patient comes very sick, almost dying. You treat them, they respond to your treatment, they get better, they walk out, they say thank you, and they walk out, and they come back after 2 months to your OPD, and you feel so happy. You feel so satisfied. Over the years, I realized there's the 2 aspects to satisfaction: personal satisfaction and professional satisfaction.
True.
When a patient gets well and goes away, gets better, comes back again for follow-up, you definitely get a personal satisfaction. You also get a professional satisfaction. And many a time we mix these 2 up.
Yeah.
For me, the real professional satisfaction is patient comes really sick. You do all the best, you do the very best that you can do, and the patient dies. And then the family tells you, thank you very much for all that you've done. You've done the best that you could do, and I know he didn't make it or she didn't make it, but thank you for all the efforts that you put. That is professional satisfaction. Because nowadays, it's always blame the doctor, right? If something goes wrong, the doctor gave a wrong medicine, the hospital didn't treat properly, the nurses didn't take care properly. It's always the blame game. But when things don't go well and then they appreciate it, that is professional satisfaction. And that's what I have learned now. Now, there are 2 aspects to satisfaction: job satisfaction, personal. If they get well, obviously anybody would be happy.
Yes.
And you're really happy. And professional satisfaction, they don't get well, they don't make it, and still people appreciate all the effort that you put.
Yes.
So post-COVID, I don't think much has changed there. Still, this personal satisfaction and professional satisfaction still remains the same.
But now, in cases where the patient doesn't make it,
Yes.
now is there a particular manner you break the news, or what exactly happens behind that closed door?
It's something, Fuju, you have to decide case by case. You cannot use the same formula to everybody. But every aspect counts. Eye contact, your body language, what you say. Because if what you say is at variance with your body language or your eye contact, it's meaningless.
Yeah.
And people are not stupid. They would understand where you're coming from. They'll understand whether you really mean what you say. So you got to make that happen, you got to really feel it.
Yeah.
The only way you can really feel it is if you put yourself in the shoes of the family.
Yeah.
If you put yourself as a family member and you think, if this was my person, how would I deal with it? How would I be feeling? So you have to put yourself in that place, and you've got to tell them and
but how
break the
can you
news.
still be so, by putting yourself, you're kind of building an attachment, right?
Yes.
How can you still be so emotionally attached to it and still do the hard job of breaking the news?
If you're emotionally attached, it's easier to break the news. If you're not attached, let's put it this way. It's easier to break the news if you're not emotionally attached. But if you want to break the news the right way, you need to be emotionally attached. And I always touch. Obviously, if I know that person is not going to be objecting to touch, but definitely I put hand on shoulder or whatever, rub the back and tell them, they're no more, we've tried our best, this is how it is. And make eye contact as far as possible, and show that you empathize with them, show that you feel with them.
Yeah.
And that's the only way out. I don't think the right approach is to just sit there and blindly tell them it's over. I don't think that's the right approach. It's easier for you because you're done and dusted and you're out. But that's not the way I would do it, and that's not the way I would tell or expect my juniors to do it. This is what I would tell them to do. Eye contact, look at them, put yourself in their shoes, touch them, and tell them.
So next segment, we have a really tiny, fun game with you.
Okay.
So I'm going to say 5 words, and the first thing that's going to strike your mind, you're going to say that.
Okay.
Okay? The first word is going to be work. Come on, quick.
Workout.
Okay. Family.
Love.
Holiday.
Fun. And no work.
Okay. Workout.
Oh. Part of my life, like breathing.
That's nice. What about art or music? You play guitar, so let's just say music.
Music, it's balm for the soul.
That's a really nice answer. Thank you so much for agreeing to be on this podcast. taking time out from your really busy schedule, from your thankless job, adding
no.
value to what we are doing, and
Thank you.
really showing support and being so warm. And one tiny question for you: if you were to take away some learning from this session that we had today, or an emotion or anything, what would be that one thing that you'd carry with you?
You know, you represent youth for me, Suju.
Okay.
And I can see that the youth of today, they have a hunger. They want to know things, and they want to know things in a scientific way. And if you, as I said, you are representing the youth right now, and if you are the representative of youth, this is what I'm taking away from. Normally, as older people, we sort of don't pay much attention to the younger generation, but the younger generation of today, I think, is very much woke and very much into it, and they want answers, and they want answers in a scientific way. That's what I'm taking away from here.
Thank you so much.
Well, guys, I hope you enjoyed this podcast. Guys and girls, I got to be politically correct here. So if you enjoyed it, please like, please watch, please subscribe, and please follow Project U, helmed by Fuju.
Thank you.
Thank you very much. Have a great day.